Hello, London. This is Birgitte Brandstrup speaking from Copenhagen. I have the pleasure of telling you about a trial we did here in Denmark. It is a reassessment of a randomized trial published in the British Journal of Anesthesia last year. We know little about what is the optimal fluid therapy for our emergency surgical patients. And which balance to reach for is controversial. Therefore, we pooled the data of the GASAR trial and divided the patients into 3 groups based on their perioperative fluid balance. We did a logistic regression and analyzed the association between fluid balance and number of patients with complications, cardiopulmonary complications being our primary endpoint. And here you see the results. The largest group was the high fluid balance group with nearly half the patients. And we must admit that most septic patients belong to that group. However, in the regression analysis, we corrected the data with a propensity score, including the sepsis score, along with tobacco use, alcohol use, ASA score, and other risk factors. And even after correction, it was clear that a high fluid balance was associated with significantly more cardiopulmonary complications. And it looks as if on a continuous scale that we have a balance around 0. We have the lowest risk of cardiopulmonary complications, whereas when it comes to the renal complications, we can see that the optimal balance is a little bit higher. It's around 2 liters positive. Therefore, we conclude that the cardiopulmonary complications were fewer at a balance less than 2 liter, and a balance less than 2 liter did not increase the risk of renal complications. Therefore, we recommend that the perioperative fluid balance do not exceed 2 liters. Thank you very much for listening and have a continuous good conference. Bye-bye.